So this is an introductory video into the care and management of central lines in children. This is in conjunction with the guidelines that are on the PEER website under the oncology section. So it's very common for children with an oncological diagnosis to have different types of central lines. So we can see two different central lines here. So we've got a tunnelled Hickman line and a Porter-Cass. So we're just going to look at some management strategies with these lines. So for tunnelled lines, you can see that they've got a nice clear dressing on. We can use things like IV3000s or Tegaderm dressings. This can be done without an aseptic technique and changed. So just if we look at this line, there's a nice coil underneath that dressing, and that's just to make sure that if that line gets pulled, it's going to pull the coil of the line instead of the line coming straight out. So if your line is long enough, wherever possible, make sure that that line is coiled. When you do so, just be careful not to kink the line itself, otherwise it will become blocked and you'll end up having to change the dressing again. Other things we use include these strips here. This is also to make sure that, again, if the line is pulled, then it pulls the dressing across of it and the top dressing to stop that line from being pulled out. Both of these should be in place at all times where possible. You may find that smaller children, the lines are coiled up the other way, and that's just to stop them dangling in the nappies as well. The other thing that you might also see is that they have wiggly bags across the bottom of them. So these are cloth bags that hold these in place to stop them getting dirty. With the Porter-Cass, it would have exactly the same dressing across the top of it. So you can use dressings for either of the lines that you have. When we change bungs, this can be again done with a normal ANTT process. So the next bit we'll do will be just to showing you the process of changing that bung. When you are preparing your tray, you can do this as an ANTT process. So make sure your tray is cleaned and that you have your equipment that you need, and just put on a pair of gloves. So because the idea of ANTT is that we aren't going to touch the key parts in this process, we can do this quite straightforward. So prepare the bionector or bung that you're going to use without touching the end. Get your saline that you're going to prime your line with and attach it onto the end of your bung. Once you've attached this, you can prime your bung and then pop back in your tray, and then you can go to the patient. So in between, change your gloves going to the patient. The most important part when you're changing a bung is check that the clamp is shut, and then you can take off the end of your bung. Take off your old bung and then clean the inside of it for 30 seconds. And then most importantly, also let it dry for 30 seconds. Once this has been done, you can then attach your new bung. So without touching the ends, screw onto your bung and then flush your line. And using a push-pause technique, flush your line, and then with the final bit, clamp and push at the same time. So when you are inserting a new port needle, this again can be done using a non-aseptic technique, so just using your standard ANTT principles. So make sure that you've got everything you need in your tray, including the correct port needle size. Remembering on your port needles there are different sizes, so make sure that you are aware which size you need for your patient. In terms of preparation, feel around where the patient's port is, do all of that before you put your gloves on and prepare to use your needle, so you know exactly where you are going to put that needle in. So prepare your tray, washing your hands and then collecting all your equipment. Again, because we're not going to be touching any of those key parts, we don't need to use a sterile field or sterile gloves. So with our port needles, there isn't a bung or bionector on the end, so we need to make sure we connect that to ensure that we have a closed circuit. Your needle also needs to be pre-primed with saline, so there's not any air in the line, and then you can go to your patient. So once you know where the line is, using a ChloraPrep wand or stick, then clean over the site in a crosswards motion for 30 seconds. And then once you have done that, leave your line to dry for 30 seconds. Take the covering off your needle, and then without touching the area that you're going to go into, place the needle into the line. Unclamp your line, flush your line with saline and check that it bleeds back before you do anything else with your line. This cap can then be taken off so that it sits flush to the skin, and the same dressing can be applied as on your other central line. Remove your line once you know that it works and it can be used. When you are going to deaccess a port, make sure that you flush the line through with saline and some Hepcel. Take the dressing off, the similar one as you would have for your Hickman line, and literally grip either side of the needle, press down against the patient's skin and pull straight out.